Welcome, everybody. I'm Dr. Howard Koh, and I'm a professor at the Harvard Chan School of Public Health. It's my great honor to be moderating this session on behalf of the Initiative on Health and Homelessness at the Harvard Chan School of Public Health on the topic of the intersection of public health and public safety, implications for homelessness. And I can't think of a more qualified individual to speak to us about this intersection than our guest today, Peter Koutoujian, the sheriff of Middlesex County in Massachusetts. Sheriff Koutoujian has spent his career addressing critical questions in public safety and public health as a prosecutor, as a public defender, as a legislator, as a professor, and a law enforcement leader. And we are very honored and pleased to have him today. To tell you a little bit more about the sheriff, he has held this post in Middlesex County since 2011, overseeing one of the largest sheriff offices in the country. In that capacity, he's pioneered data-driven correctional programs that's reduced recidivism and set national benchmarks. And he's been recognized nationwide as promoting criminal justice reform, mental health, and addiction treatment. He is a leading voice on how law enforcement can address public health challenges. And as an example of the respect he has garnered in our state and nationwide, the sheriff has been elected president not only of the Massachusetts Sheriff's Association, but also president of the Major County Sheriffs of America. Very importantly, before becoming sheriff in Middlesex County, Sheriff Koutoujian was the chair of the Joint Committee on Public Health in the State House, a Massachusetts state representative for 14 years, and he focused on issues such as health care, health reform, substance use disorders, and public safety policy. He's a Harvard-trained public administrator with degrees in law and psychology, and he still continues to teach criminal justice and leadership courses. And on a very personal note, I had the great honor of first meeting Peter 20 years ago when I was a state health commissioner, and he was a leading member of the legislature here in Massachusetts. And I can vouch for the fact that he is one of the most dedicated public servants you will ever meet. So Sheriff Koutoujian, welcome. We're thrilled to have you here. The sheriff will speak for about 30 to 35 minutes. And during that time, for the audience, please submit your questions to the Q&A function. And then we'll have ample time for Q&A after his prepared remarks. And also, I really want to thank our fearless program manager, Emily Lizovi, who will be helping me with the Q&A part of this talk. So Peter, welcome. It's great to see you. And Peter is currently overseas, but he made special time to show his presentation with us today. So Peter, welcome.
Thank you, Dr. Koh. Great to join you and the Harvard Chan School of Public Health and the Initiative on Health and Homelessness. Something that I've been concerned with and seen the intersections with for many years now. I'm proud to be part of this event, and so much so that I am in my mother-in-law's house here in Alcalá de Henares, just outside of Madrid, Spain. It's beautiful over here. It's a beautiful medieval city. I walked around in Madrid today. Manchester City is in town to play Real Madrid, which I'll be going out to watch. And if you've ever seen some of the Man City fans come into a town and start to take over, they've already done so here in Madrid, and it should be an exciting game to watch tonight if you've got the ability to turn that on. I've had a relationship with Dr. Koh for many years, and so I committed to this webinar, many weeks, months ago. I don't know how long ago, but despite the fact I was traveling, I knew it was important that I make the accommodations to make this happen. This is too important an issue, and Dr. Koh is too important a person and a friend, quite honestly, to miss something like this. I want to make our time as interesting and fruitful as possible so that by the end of this session, you'll have a better understanding of how what we do behind the wall can positively impact the lives of our incarcerated individuals once they step outside of the wall. That includes ensuring, very importantly, a place to sleep for the night. Now, I'll speak a little bit about populations that are unhoused or homeless, and I'll speak about those that are incarcerated or justice involved. Please don't think that I'm blending these two together. there are many commonalities in their placements, I guess you say, but in their symptoms, in the drivers that brought them to these places. But they are not the same population. I want to be very clear about that. I won't go through my whole bio in detail. I do want to note my history. I have you see a picture there, which is a little bit more recently, but I graduated from the Kennedy School of Government and have a master's in public administration from there. But I started my career firstly after law school as a public defender, then as a prosecutor, and then as a state representative, where I met Dr. Koh, and specialized in healthcare. I was the chair of the Committee on Healthcare, and we did a lot of great and motivative and impactful work back many years ago, and I like to think we still continue to do so. My passion for my work in public safety comes from my work, the genesis of my work in public health. I never thought I would be sheriff. I never coveted, it never aspired to be sheriff until the opportunity presented itself under Governor Deval Patrick's administration. And I have come to love this job, and I've seen the importance of this job and the opportunities of this job to provide for a community that sometimes others just don't care about or think about. And I've come to love this job deeply. What you'll see on your screen, by the way, is the best part of my job is sheriff of Middlesex County, and Harvard's seen this show a couple of times. But as a Middlesex sheriff, I formally, according to the charter of Harvard University, have formally opened and closed the Harvard commencement exercises. So for those Harvard students that have seen that unique feature of the commencements, or those that will be graduating, pay special attention. Again, it's the best thing I do as sheriff. It's not the meaningful stuff, but it's really, I love it. It's a really fun day. Next slide, please. I'll agree with, with IHH when you say that homelessness is among the most egregious public health failures of our society. I see this often. I see this with our justice-involved people too. Failures of our society. Frequent topic of conversations during my time as Major County Sheriffs of America president, especially among Western sheriffs, were the issue of encampments. They were the most visible sign of the issue, but the issue is much more pervasive and complex than just encampments. We can all say, this is what we see, but this is not what it actually exists in our communities. I've walked in these encampments around in Middlesex County, up in Greater Lowell area. I've done this with some of my classes that I taught at UMass Lowell, brought in the students. We have a staffer, Louis Diaz, who is a person with lived experience, who does homelessness outreach regularly as part of his job as a reentry navigator for our facility. And I've also visited the encampments in Boston and seen close up what goes on in those communities, so to speak. I'll also say that when I would go out to Lowell to the encampments with Louis Diaz, that it was really heartwarming to see how warmly he was greeted by the members of those communities. They were really happy to see Louis and anyone else from outside of their community that cared enough to come and meet with them and speak to them and understand what they were going through. It was a really powerful experience. And Louis was one of those guys that was always doing it, very, very popular and very loved within those communities of people that live unseen among us. Homelessness increased nationwide 18% between 2023 and 2024. Massachusetts homeless population increased by 53% from 19,000 in 2023 to just above 29,000 in 2024. So 53% increase here in Massachusetts. Now, I'm sure that some of you might have done this thing that you see portrayed in this photo here. I volunteered for the City of Boston homelessness census that I've done a few years. Usually, it's always done in the middle of the night. It's always seems to be the coldest night of the year. which is a particularly impactful time to see people out in the streets and in the subways and wherever, in the bays, in the ATM, rooms as you enter the banks. Really hard to see here. You can see me. I'm with Marty Walsh, former Secretary of Labor, Representative Cullinane, former U.S. Attorney and District Attorney Rachel Rollins as well in here, all participating in this homelessness census. This year's census just happened 2 weeks ago. And as of last year's census on January 31st, 2024, 3,720 families were homeless, 9% increase over 2023. And one thing to note is that they were all in shelters, and there were no families that were all in the street. This is families. So no families were in the street. 2,000 individuals were homeless, 134 were unsheltered. And that was a 12% increase from 2023. So the problem continues to grow, no matter what we seem to have tried to do to stop it. Most common issues are, mental health, substance use disorder, substance use disorder, food insecurity, joblessness, and quite honestly, they're the same issues that lead the characteristics of those people that are in my care. I say this, I've been saying this for many years. We used to learn about the social determinants of health, and we find now that I'm in this role that they are almost identical to the social determinants of justice involvement, right down the path, right? Next slide. Sheriffs have a key role in addressing factors that lead to homelessness. We're responsible for a population uniquely at risk for homelessness. We have populations with substance use disorder and mental health and many other issues that we treat. Nationwide jails have seen about 7 million releases each year, meaning people going back into the communities. Prisons see about 500,000 to 600,000 people, but they don't see as much churn. 99% of the population that I serve in my care will return to their community someday, and most of them will be needing, services in order to successfully re-enter their communities as well. Our clients are open to the same issues as yours. Someone seeking treatment comes to you with long gaps in their medical record. Often they were incarcerated for a period of that time. And by the way, we have those records which are available for health providers to continue to provide care for those that are now unhoused and being served by a shelter in the communities as well. So I believe that sheriffs have a unique position to address 4 key tipping points towards homelessness. Number 1, the devastating effect of incarceration. Formerly incarcerated people are 10 times more likely than the general population to be homeless. Number 2, substance use and mental health. Individuals preparing to re-enter our communities from carceral facilities are 120 times more likely to suffer a fatal overdose. Number 3, estrangement from family supports and networks. We call this fixing the shrapnel caused by incarceration, and that those events within a family that led to incarceration. And number 4, people who become homeless for financial reasons. They're priced out because of the rising cost of rent. And by the way, having a loved one become incarcerated for a year or two places an enormous strain on a family's finances as well. So we kind of forget to realize that the impact of that incarceration can have on other family members and perhaps them becoming unhoused as well. So let's be clear. I want to be very clear here. Incarceration is not the ideal setting for treatment, but if we do have someone that comes under our care and custody, then I'm going to use that as an opportunity for treatment. Next slide. The constitutional role of sheriff is to provide care, custody, and control for individuals held on bail or sentenced to a house of corrections or a Middlesex County from a Middlesex County court. We've had a lot of movement. This is a churning population coming in, going out, coming in, going out. We've had just over 3,000 admissions last year and almost 3,000 releases. It's about 2/3 sentenced individuals and 1/3 sentenced individuals and 2/3 pretrial, meaning they're held on bail or held without bail, which is even more unstable for those individuals that are in our custody. We have Massachusetts, we have law enforcement powers, but our primary mission is corrections and the management of the House of Corrections. My focus is 100% on the care of those that are in my custody. So I'm able to focus myself on the care of those that are in my custody in ways that other sheriff's offices across the country cannot do. So we have about 700 employees, sworn and civilian, highly professional staff, highly trained, motivated, committed to the mission of reentry. And we provide individuals who experience incarceration with resources necessary to secure a successful and lasting reentry back into their families or into their communities and into society, especially those who are struggling with substance use or mental health disorders. Next slide. We work with the same population that sometimes does end up unhoused, facing the same needs. I know this because we rigorously collect data on our population to best identify their needs. And as of today, almost 50% have a diagnosed substance use disorder. Diagnosed substance use, not. We're very careful about our data. Almost 60% already have a diagnosed mental illness. 72% have a chronic illness, ranging from asthma to cancer, and 75% have an open mental health case within our facility with our clinicians. So we're treating 3/4 of our populations. They're on our mental case watch list, so to speak, or treatment list, so to speak. The co-occurrence of these diagnoses is particularly heartbreaking. Many of you might know about co-occurrence, but 92% of those with substance use disorder already have a diagnosed mental illness. Troubling compounding factors in the treatment of either one of those. 76% of those chronic illnesses are psychotic disorders as defined by National Commission on Correctional Health Care, and 74% of individuals with chronic illness also have co-occurring mental health diagnosis. Sadly, I'm sure that these numbers do not surprise you at all. Working with an unhoused population where co-occurrence is a common occurrence. We all know someone, and we all know that these people are not those people, but there are people, and there are friends and our neighbors children and families. So sadly, we run a pretty good treatment center, but it's a treatment center where your copay is a criminal charge instead of a financial one. And while I am proud of the program we run at the Middlesex Jail and House of Corrections, you shouldn't have to come to jail to get good programming. This is that failure of society I mentioned. This programming and these resources should be available to you while you're in your homes, while you're on the streets, while you're in your communities. You shouldn't have to come to jail to get that. So what does that care look like? How do we, next slide, please. How many of you have seen Shawshank Redemption? There's a moment in the movie where Brooks, the old lifer, is finally released from jail. You can see his photo right here. He's at the main gate, of the prison. The guards wish him well. They close the gates behind him and they walk away. You can see them walking off into the distance, leaving him totally on his own with the clothes on his back and a satchel at his side. And if he's lucky, maybe they gave him bus fare. Brooks contemplates recidivating almost immediately and ultimately takes his own life because the culture shock of reentry was too great for him to bear. And I could see people leaving my facility every day in the same situation. By the way, it's as someone is planning to be out, if they're sentenced in 6 months, they've got a light to their eyes. They can see a joy to themselves knowing they're going to be getting out. But as that time gets closer to their release date, you can see that light becoming more tense, more worried, more fearful, because they're not exactly sure what they're going to do when they get back out. So what was once excitement about getting out now becomes worry about the very same end, which is getting out. Thankfully, this is, but this is what good correctional facilities can do for people. Reentry planning begins on day one of your incarceration, not 30 days out or 90 days out or a year out. On your first day, as we do our intakes, we look at what you need in order to prop yourself up to make you a better, stronger person to be able to have a successful reentry. These are, for us, that means evidence-based, results-driven programming that builds skills and preparation for reentry, leading to a warrant handoff upon release to family, community-based programs, and referrals to housing as needed. Next slide. Now, we know that incarceration is disruptive and traumatic to the individual, but incarceration is a big contributor to homelessness. We know that, but it is also a key opportunity for intervention to address these social determinants of health and justice involvement I mentioned earlier. By tailoring evidence-based programming to these specific populations, we can best address the criminogenic risk factors that are all too often left unaddressed throughout a long period of their lives. And so what are these services that we can offer? Next slide. Our philosophy is that unique programming for unique populations produces unique results. During this time in custody, individuals can be exposed to a variety of programs that address their unique circumstances. People like to think that people that are incarcerated are all alike, and nothing could be further from the truth. And so if you treat them like they're all alike, then you will fail in your mission to prepare them for their individual reentries. In all of our program, we are relentlessly data-driven. If a program isn't working, I'll shut it down, I'll retool it, I'll look at what can make it better, and I'll relaunch it. With our first medication-assisted treatment example, it was a program I was really proud of. It was one of the very first in the entire country to begin using medication-assisted treatment to treat opioid addiction. And my first version of the program failed. I call it an abject failure. There was a lot of reasons for it. I was a new sheriff. There was a culture inside the facility. They didn't seem to understand what I was trying to do. And quite honestly, even in the community settings, they weren't ready to have people coming out of carceral facilities for those supports. And it failed all around. We actually took a year to study it, to put together a better plan. And now it has been a model program for the country for about 12 years and has been repeatedly cited in academic journals as a successful model showing efficacy. I think that the risk of faking a program and serving people incorrectly is too high, and I could have propped that up, but that wasn't fair to the people that we serve, but it wasn't fair to the larger population we serve. So I'm proud of the robust and grounded programming we offer. In our medication-assisted treatment program, we have about an 18% recidivism rate, much lower than the 42% national recidivism rate for jails. Our housing unit for military veterans has a 14% recidivism rate, meaning 86% of people never come back over that 3-year period that we look to. Our older adult reentry unit, something that first of its kind in the nation that we just began working with BU School of Occupational Therapy and the UMass Boston School of McCormick School of Gerontology. For inmates 55 plus, successful. We will, we're starting to get the data on that, but we also do a Frederick Douglass project. We have a women's pre-release center that we're kind of getting women ready for that next stage of their lives. Project Earth, education and restoration through horticulture. Our family support services for families program and our family mediation program using conflict resolution are a bunch of the great programs that we offer. But as I said, you shouldn't have to come to jail to get good programming, but they are good treatment and human services that should be more widely available to people in our communities. Next slide. So what does reentry look like? We ensure that these programs are explicitly tied to reentry goals. And again, that starts on day one. Upon arrival, each new inmate that enters our facility meets with intake staff. They're assigned a case manager who designs a specialized plan for that individual's reentry. We use the Ohio Risk Assessment System, or RAS. It's a risk needs assessment tool for sentenced individuals, and it allows us to recommend programming based on the areas that they have deficits in. We're able to create an individualized service plan for each sentenced inmate. In every case, case managers and clinicians will work with them while they're in the facility to find programs, housing, and family support for when they leave. And the goal is to keep them engaged and provide them with skills that relate to their life that they will be living outside their walls. Now, we check in with them regularly. Do you have a plan? Some of the questions we ask them about and help them plan for is, do you have a plan for when they leave? Do they have a job? Do they have an updated identification? Do they have medical or other appointments set up to take care of their needs that we were taking care of inside? Then we help them with even finding birth certificates, financial literacy, debt management, high set or GED courses for high school equivalency tests, and college courses up to associate's degree, all leading to a warm handoff so they can continue to receive the care on the outside. Let me just speak a little bit in the next slide about homelessness and reentry. Homelessness prevention is not a program or a unit. It is instead a part of every individual's path to reentry for us at the Middlesex Sheriff's Office. It's a component of every program and unit that we run throughout our entire facility. The way we look at someone trying to reenter society, we want you to go to your medical appointment. We want you to go to your job, to be able to get a job and go to your job. But if you don't have a safe place to lay your head at night, how can you be focused on meeting all of these responsibilities each day? And then the world begins to fall apart more and more. So we always ask, where are you going when you are released? And when we hear, I have no place to go, we start getting to work on behalf of that individual. Case managers try to find programming, family to take them in, placement in a sober home or other facilities that can provide support, shelters for those difficult to place, such as sex offenders sometimes, which is a greater challenge for us. And a stay at a shelter offers the possibility of placement into a transitional program, which is crucially important as well. Upon release, the warm handoff, if they have a substance use disorder, we'll connect them to sober housing, long-term residential housing, up to 90 days. They'll have rules, structure, smoother transition, and a case manager at the facility. Our reentry navigators, which is crucially important, all of our medication-assisted treatment participants are assigned patient navigators, something that I learned from my public health days and how to remember this. Navigators were just starting to be used in the healthcare systems as a way to support people to make sure they were remembering their appointments, making their appointments, taking their medications, filling their prescriptions, making sure they were taking care of themselves. What they found was they had a navigator assigned to these folks, that the cost of healthcare went down, the outcomes went up, and patient satisfaction went up. So I actually took that model and applied it to a medication-assisted treatment navigator as well. They will generally counsel family members about expectations, want their loved ones return to them, to bridge the gap between release and their life outside, make sure treatment is set up for when they leave, and they'll work with partners such as our Behavioral Health Justice Initiative, which is a mental health navigator program that we have that people that struggle with mental illness to help them support them upon their release. And by the way, the best navigators are relentless. They just continue to stay on top of you as that positive, engaging person in your life that cares about you and your wellness and your well-being in a way that will get you to be successful as you step out. Louis Diaz is that guy for us, and he is, I've got a couple of numbers here. He is out there relentlessly reaching out to people. On his own phone, he has 276 photos of people that he has known that have died from overdose. This is the community he is continuing to serve. And he says he does this because he's always worrying that he's going to come across someone too late. It's a reminder to him. And sadly, on 4 occasions, he did come across someone too late. And sadly, he was the only one looking for that individual. And the photos remind him of that. Family estrangement, I'll just kind of rough through a couple of these things. Family estrangement is a really important issue for both justice involvement as well as becoming unhoused. The family is an important role in your successful reentry. I call it the shrapnel, as I did before. Oftentimes they burn those bridges. They've worn out those relationships. And so they're not easy to come back to. A recent speaker on this series, Kevin Adler, spoke of relational poverty, not having enough social support systems and disconnection. He created a stat when people were experiencing homelessness that were asked what was the cause of it. And 1 in 3 individuals attributed some sort of relational brokenness to a primary cause for their homelessness. And we have a number of programs that support them through that. I'm just going to skip through a little bit because I want to get to questions as quickly as possible. Family support services, we have a program that supports the families, almost 50,000 minutes of contact helping 6,500 families. By the way, this is the only one that exists in the country. We created this out of nothing because I knew that this was a population. The families don't get any supports while their loved ones are incarcerated. We've also been working on family mediation, restoring fractured relationships through Middlesex Community College, and it's a program that's been working very well right now going on. Diversionary efforts, next slide, please. Just trying to keep people out of jail. You know, the best type of, you know, way to avoid recidivism is not to be justice involved or to be incarcerated in the first place. So we're always trying diversionary services, like the Middlesex County Restoration Center Commission that I co-chair, which will bring these types of services to those that are in really tough shape in their communities, usually with substance use disorder and mental health as well. This has been 5 years of work. We studied programs in Tucson, Arizona, and Bexar County, Texas, and on and on. So let me just kind of close this off with a call to action. And this is what something you folks that are out there studying this, working in this field, or about to work in this field, I ask you to consider this call to action. This photo is here, and this is probably no better way to show these three beautiful children. They're my children. And every year we go to the Pine Street Inn in here in Boston and serve, you know, dinner on Thanksgiving evening. We graduated from serving in the women's shelter to the men's shelter, you know, and it has been a tradition we've done for, you know, I don't know, 10 or 15 years. So very, not 15 years, I get maybe over 10 or 12 years, I guess. And you know, what it is it exposes them to what people are going through. This is just one of a number of different community, you know, engagements that I try to bring them to, so they can understand who else is out there and who else suffers, and to understand true compassion and support for those that are in the shadows of our societies as well. If there's a main takeaway from today, aside from my beautiful children there, it's this: if you're working in the field, invite your local sheriff to be part of your work in homelessness. They can identify and work with at-risk individuals while they're still in custody, and they can oftentimes give them services or help you steer them to services that can help. For many communities outside Massachusetts, sheriffs are frontline first responders, and so they deal with these people that are homeless or unhoused, and can be part of that outreach team that you can work with as well. One thing that is also important to know is often law enforcement, you may not think of them as a partner. You may not think of them as understanding the population that you understand, but the fact is sometimes that's not true. But all too often, no one took the time to educate people in law enforcement in a way that let them understand who we're talking about and how they can be of help. So I hope this is better able to, next slide. As you can tell, I'm pretty proud of the work that we do at the Middlesex Sheriff's Office. I hope you understand our role a little bit better, and in ways that I can serve our communities, not just with justice involvement, but those that are unhoused as well. And I'll just, and I think our Family Support Services program is especially one of those. So let me close it off with that, Dr. Koh, and answer any questions that, you know, your students or you or the participants might have.
Well, thank you, Mr. Sheriff. What an inspiring overview, and what a systems approach you have here. We could spend hours talking about each part of your presentation here. Let me say, as we begin the Q&A part, that we're very proud that this presentation is co-sponsored by three other parts of Harvard University: the Joint Center for Housing Studies, the Government Performance Lab at the Harvard Kennedy School, your alma mater, Peter, and also the Harvard Advanced Leadership Initiative, or ALI. And we're very proud that across Harvard, the four of our groups here work together to sponsor high-profile speakers like you, Peter. So thank you. Let me say that there are not too many folks like you, Peter, who understand these challenges from both the public safety and public health point of view. You know, we in public health and in the community want to support you and connect to you and your peers better. What's the most important thing we can do to connect and support your work, especially on homelessness prevention? And if I can say, you know, you're a person who has tremendous expertise in public health before you took on this job. A lot of your colleagues probably don't have that background. So Now, how do we make that connection stronger? You said to invite, get closer to your local sheriff. Many of us may not even know who our local sheriff is, but do you want to say a little bit
Yeah,
about that connection to start off?
yeah, I think, Howard, I think honestly, we're going to be dealing, and again, I don't mean that the entire unhoused population is like mixing between jail and back out into unhoused status, right? I mean, quite honestly, when it actually is, now that I'm thinking about it, when I served dinner this last Thanksgiving Eve with my family, um, we saw a number of uh, young men. They looked like they were from Africa, very well dressed, very, just like really put together. They looked like executives, but they were being served in a shelter,
Hmm.
right? And so when we talk about, those people, I mean, you can't say they're just those people, because to me, that was evidence of people that just don't have a place to live. And they just need to live at that shelter until they can find a way to get to a place that they live. But I also ran into a gentleman that served time in my facility. Um, and it was a heartwarming meeting, because actually he told me about someone very important to him that passed away while he was incarcerated, and he was devastated. But it was like the only person that was good in his life. Very sad case. He was a man that struggled a lot. And the fact that we took care of him, a person was out of state. We couldn't get him to the services, which is something we would do, but we took care of him, and it was really beautiful to hear him speak about the fact that he felt like he was respected and cared for and loved, quite honestly, in a jail during one of the most difficult points of his life. I think that probably no one more than those leaders in law enforcement really understand who we're dealing with. But I think we need to be educated. I was educated through my experience with you at the State House when I was chairman of the Committee on Healthcare. So much of that I brought right into here. I had that education, but for many of these people, they haven't had that education. So go to meet with them, engage with them as well. And one more thing that I will say, Howard, too, is if you're for those that are aspiring to do something in this field, there is so much work that needs to be done. And I'd ask that, when you get out there, see what works, see if it's replicable, see if we can quantify it, see how much it costs. Let's find the programs that work and then replicate them across the way. Now, it might be different. Some might work in one area versus another because of certain things, but find out what works, show efficacy if it works, and then replicate it, and then collect that data. And let's talk about how much it costs, because this is a very, very costly endeavor to support those that are homeless right now. Very costly, and no one wants to address that. The numbers are astronomical, and they're frightening, and they're embarrassing. And the worst part is why they're really embarrassing, because they're not really helping, obviously, because the homeless population continues to rise despite spending hundreds of millions of dollars from each state on these very issues, and yet the problem continues to rise. So what are we doing with that money? We can use it better. We just have to figure out how to do it. And I task a lot of the people that are on this call with bringing that. And I'll say one last thing, Howard. When I was the chair of the Committee on Healthcare, I used to have a lot of public health groups come in. Really wonderful, beautiful people, well-meaning, caring. They gave everything for public health in communities that no one else cared for, right? You know the people I'm talking about, Howard, right?
Yeah.
Beautiful
Yeah.
human beings. And they'd come in and we'd hold hands, we'd sing Kumbaya, and we'd say, we need to do more. And they'd say, well, we need more money. And I'd say, well, give me some data. And they'd say, well, it's really important. And they wouldn't really have the data. And it wasn't their fault. It was just the way it was. And my feeling is you need to have that data to present to higher authorities, funding authorities, whatever it is, because just that powerful story, which is as compelling as it is not enough to do something right. You have to have some of that data to make them feel reassured to invest in your causes. This is something that I think that everyone on this call can take away. I always say you lead it, when you're advocating for your cause, you lead with emotion, but then you drive it with data, right? You lead with emotion, you connect on emotional level. This is why it's important you tell some stories. You make people feel the humanity of what you're speaking about, but then you've got to drive it with data to be taken seriously and to really push that issue forward.
Thank you, Peter. Boy, your multiple perspectives are so invaluable here. So, Sheriff, we have over 400 participants here, several dozen questions in the chat function. So Emily Lazovi, our program manager, will now take over for some more questions for you. Emily?
Hello. All right. Sheriff, thank you. We have a lot of questions here, some good questions. And there's one that sort of does a good job of summarizing some others. So I'm going to read Sam's question. He says, "Hello, Sheriff. What are your thoughts on how police departments can best partner with homeless service providers to build trust and connect unsheltered individuals with necessary support services? In the wake of the Supreme Court's decision in summer 2024, criminalization of unsheltered homelessness could create hesitation for interacting with law enforcement. So, what are your thoughts on that?"
Yeah, it's Sam, I think. Sam, thank you for that question. The criminalization of homelessness is just wrong, you know? I think the intent, one, I suppose the intent is always to clean up a certain area, right? Because a community doesn't want to see, it pains them to see this, right? It pains them to look into the mirror and see what's ailing. I always think of people that are justice involved and those that are incarcerated, formerly incarcerated, justice involved, and homeless as the canaries in the coal mine, right? They're the more vulnerable for many different reasons, members of our communities that fall ill and show the weaknesses of our system, the fact that we fail these people, right? So I find that these people show us who we really are as a community and how we fail. And we can talk all we want, but unless we're caring for these people, then we are not who we like to think we are, quite honestly. So I don't like the idea of the criminalization of homelessness. Something I just, it doesn't work, quite honestly. Anyway, even if you don't like it, it don't work. But you can do other things. Like we started a Middlesex County Restoration Center Commission, and we're just about to open in the next couple of years. And this is a place that allows law enforcement and hospitals and walk-ins to be treated for, if they're in mental health crisis or they're in their substance use crisis, right? So that if there's something going on where law enforcement, sometimes the only tool that they have in their belt to address an issue is arrest, which is something I don't think they want to really have to do. And we certainly don't want that to be as the only tool they have. But this is a place they can bring those that might be subject to, justice involvement to a restoration center. They've been very successful, as I said, in Tucson, Arizona, Bexar County, I think there's one in Michigan. It's a place where law enforcement and hospital, it gets police to bring someone in for treatment instead of arresting them. It also gets them back on the street. It allows our emergency rooms not to be boarded, like so fully boarded all the time, to be overrun with these cases that one are unsolvable in an emergency room, and secondly don't pay the hospital, so they struggle with that too. And so it's a place for them to go, and it's a place for walk-ins. More programs like restoration centers that have been wildly successful across the country, not replicated nearly as much as they should be, is really one of the answers, right? Our crisis stabilization centers that we're having around, these are the places we really need to go for those answers. And quite honestly, again, on the other side, for those that simply, being homeless is really a financial repercussion, then I think we have to take a look at, just, the cost of housing. It is transportation, affecting the cost of what's affecting the cost of housing. What we can, listen, I've heard it said before, it's kind of interesting. You can't just build your way to affordable housing. You have to create better public transportation systems so you can extend your reach for more affordable housing for those people that might want to work as well. So we have a lot to do, but criminalizing this population is simply not it. Now, I will say this too. There are people out there that simply will not participate. Some of these places, there's a lot of bad stuff going on in them. There's a lot of drug trafficking and human trafficking. I've seen it just as a pedestrian walking through. And I don't know how you get those people the help that they may need. and incarcerating them is certainly not the answer. But I think we've got to find a way to be able to reach those people, get whoever we can out of those areas, but also then how do we address that last front that will not participate in programming for whatever reason they just don't want to do.
Thank you. Thank you for presenting all of the programs that you're offering out of your office. And folks are saying thanks for saying that the original MAP program failed. Could you say more about what were the red flags kind of pointing to a failing program, how you identified that, and what made you sort of shut it all down and start from scratch?
Yeah, so that's a great question. So as I said, I call it an abject failure. And the reason I say this, by the way, is I've seen, and Howard's probably seen this too. You get all these people that start a program and they claim how great it is, and they're, this is just, and then when you actually look under the hood, it's a terrible program. It shows no results. It's really expensive, but they continue to prop it up. And I just was not going to do that. I knew medication-assisted treatment program could be a great answer for those that were addicted, that are a high part of my population. And more importantly, we consider about recidivism, not having them return to a carceral facility within 1 year, 3 years, whatever it is. But the real way I've become to think about being sheriff is harm reduction. How can we keep people alive when they get back outside? In the governor's report from a couple of years ago, attested to the fact that those that leave carceral facilities are 120 times more likely to die as a result of an overdose death within even a couple of weeks after being released from a carceral facility. So we're actually about to be published in a peer-reviewed journal on that program that we did that showed a reduction in overdose deaths after leaving, and also an increase in the time until death, even if a death did occur, a longer time than the other population that was untreated, right? So that's really important. The reason it failed was no one was ready for it. I was a new sheriff. It was a new facility. They didn't have an understanding of what medication-assisted treatment was. This was at the time only using Vivitrol, which is the injectable form of naltrexone, which is an agonist, which is not methadone or Suboxone, but everyone thought it was methadone. Even the community providers thought we were providing methadone. Even probation and parole wouldn't keep people out if they were on medication-assisted treatment, thinking it was methadone, and they didn't like methadone. It was another form of addiction, which was all wrong. So when you're dealing with that, and we actually trained our workforce, but they had a hard time understanding. But then when you go out into the community and work with community health centers and treatment centers and find no partners that wanted to work with you because they didn't understand what the issue was, again, the blessing of me being a healthcare chair, then that fails. And also, we weren't collecting any data. There was no strictures to the program. I just assumed that everything was being done the way that I knew it should be done, and it wasn't being done the right way. So I scrapped the whole thing. And it is a testament, not so much to me, but to me in our office. We could have propped that up and just kept going and just changed it around. We actually scrapped the whole thing. We stopped the whole thing. I said, stop, hard stop, no more. And then we went out and studied for well over a year and came up with a much better program, utilizing those navigators, which have been a significant reason for the difference. So it was a place where we didn't have enough partners. The communities were not ready, and we overcame that. Now that's not a problem in any of our programs in our jail, at the Middlesex Jail and House of Corrections now at the Sheriff's Office.
Thank you. Sort of building off of that, we have a question from Bob. He said the scope and thoughtfulness of your programs are amazing. Do you know how widespread these programs are throughout the country? You said that MAP program has been sort of a model, but have other jurisdictions adopted your programs or versions of them that fit their jurisdiction? And if they haven't, what prevents those sheriffs without them from adopting them? Have you talked about cost per person or anything like that?
That's a great question, Bob. So this is my feeling. As I said, I've had many leaders, police chiefs, sheriffs, many others, again, speak about their programs. And then when you looked at the data, it just doesn't exist. It's all fraudulent. It's just all fake. Or they talk about their program being great, but then they never share any information on how it works or the data or anything, which is also fraudulent to me. If you're doing a program and it's working, then you have a responsibility. This is something for all of you that are watching this to understand. You have a responsibility to make that program as strong as you can and then to share it. By the way, you also have a responsibility, if you see a program out there that looks promising, to take that program and replicate it and then make adjustments as you need to make it better on your side. This is all of our responsibilities. Because of, maybe my being a unique player in this world, I find that we are creating, first in the nation programs a lot. And I don't say that because I think we're great. It's just that I've been frustrated that we can't copy as many as we'd like. And whether it's our young adult offender program, the first of its kind in the jail, a family support service program, first of its kind in a jail, our medication assisted treatment, one of the very first of its kind. I can give you a whole bunch more. But the fact is, if it's not out there, then you have a responsibility to create it. And if it is out there, then you have a responsibility to copy it, plagiarize it, take it, whatever it is. And what we've done is, when we have programs that have worked, we just got back from a National Sheriff's Institute where we spoke about our Frederick Douglass program, which is a remarkable program, which I did see out in another jail operation in Michigan, and took it to replicate it in ours. I think we've done a great job with it. So this is all of our responsibility, to drive innovation, to plagiarize innovation, to improve innovation, to report innovation, so that others can use that as well. All of our responsibility. You got me really excited there with that one, Bob, as you can tell.
Thank you. This is a question about working with local homeless continuums of care. Have you or your staff been a part of local homeless continuums of care? How do you recommend those continuums invite very busy sheriff's offices to be part of these important homeless system planning bodies?
I mean, I think, honestly, it's part of the programmatic side of what we do, right? I mean, in any sheriff's office, and quite honestly, even in police stations too, you've got your operational side, but then you've got your programmatic side. And I think that successful reentry, I mean, again, a lot of these people did not have housing when they came in. They will not have housing when they go back out. And then they will come back in again, because this will stress the rest of their lives and cause them to fail in their successful reentry anyway. And by the way, it's a terrible way to live, and we shouldn't allow anyone to live like that. I mean, I've been to these encampments, and while these communities are so often, they're very happy to be part of that. That's the weird thing about a homeless encampment. If many of you have gone, it's a community that cares very much about each other, and they feel strongly about their community. And sometimes I think that's part of the reason they don't want to leave, because they found a community that accepts them and loves them and supports them in a way that may not be what the rest of us think they should be supported, but they feel loved. I've been to these places where we walk in with Louis Diaz, and the whole camp turns around as they're sitting around in a bunch of lawn chairs, broke down lawn chairs. They see Louis and me walking in, and they don't care about the sheriff. They say, "Louis, Louis!" And they get all excited and they yell Louis, because Louis cares about them. So you've got to appeal to the programmatic side about, connecting with them, to allow that part. It's not going to be arrest issues. It's going to be the programmatic side, supporting communities. That is the way you want to connect with your local sheriffs and otherwise. And by the way, if you do have an interest in connecting with a sheriff, and I happen to know that sheriff, you can feel free to reach out to me. My email address is right there, and I'd be glad to try to connect you as well.
Thank you very much. We only have a few minutes left, so I want to turn it back over to Howard to sort of wrap us up. But I wanted to say that we have a lot of really great.
Very quickly.
All right, let's do one more. Let's see. Oh, here's a good one to end on, I guess. Well, I don't know. Have your reentry programs or resources and/or staff been affected by the current administration transition? And if so, how?
Say that, but have they been affected by what?
The administration transition.
You mean the federal administration transition?
Yes.
Not yet. You mean, like, if we're talking about immigration issues, that's something we have to address, right? But as far as on the issue of homelessness, no, we haven't seen anything like that yet. Listen, I'm assuming that monies are going to be less than before, and I think we're all going to have to figure that out, quite honestly. You know, what I will say to a lot of people is this is a different administration, but we've had this administration before too. We're gonna have to figure it out, you know, and you know, we just have to figure it out. I think we all got to just, you know, we all just have to figure it out. And I don't know if this is a great one to end with, Emily, but you know, we can, you know, in the end, we can't clutch our pearls, right? If we clutch our pearls, we're not going to be doing something. And we can scream and protest, but that may not do something. We got to figure it out. And so, you know, while it might feel good to scream and cry, and maybe we should do that, in the end, we got to get to business and support people, right? It feels good to scream and cry, but we got to get it done. We got to help out. We got to support people. We got to figure it out no matter what we're given. We just got to find a way to do it.
Well, there's a good inspirational note to end on, I think. So maybe not a terrible question to end on, but I'll turn it back over to Howard for the next couple of minutes. And I will say there's a lot of great questions here. So I'll send them to the sheriff's office.
They can all write an email to me. Yes, absolutely.
But thank you.
Sorry, sorry to my staff there, by the way. I just invited a few hundred people to write me emails. So sorry, staff.
We are so fortunate, Peter, to get to hear your passion and insights and experience over the last hour. And we're just thrilled to make this introduction to people who may not have heard much about your work before today. We want to stay close to you. You're just an extraordinary interdisciplinary leader. We want to keep building programs and efforts with you. And I hope we have many more sessions like this through our work at the initiative. I also, again, want to thank our great colleagues at Harvard at the Joint Center for Housing Studies, the Government Performance Lab at the Kennedy School, the Harvard Advanced Leadership Initiative, and individually to Emily, who just did a wonderful job and also put this whole thing together in collaboration with Kirk Vanda and David Bratton and David Luberoff and many, many others. This is a monthly series, so the next presentation will be March 11th, Tuesday from 1 to 2 p.m. It'll be on the topic of expanding affordable housing to address homelessness, lessons from the master leasing programs of New York City and LA. So please tune in to that. So Sheriff, thank you so much. We respect you and please keep going. We want to work closely with you going forward in this very, very critical time. So thank you so much. And thank you so much, everybody.
Thank you, Doctor.
Okay, you take care. Bye-bye.